Hello, my name is Krysteena Anderson. I am a LPN to BSN student with Indiana State University. This is NURC 444 Community Health Nursing, and I will be discussing HIV/AIDS. Learning objectives. To learn what HIV/AIDS is, to discuss how HIV/AIDS is contracted, to review the timeline of HIV from discovery in the U.S., to briefly discuss who Ryan White is and his impact on the HIV community, to identify the interventions in place to stop the spread of HIV/AIDS, and to identify how one can live with HIV/AIDS. What is HIV/AIDS? HIV, also known as human immunodeficiency virus, is a viral infection that attacks a person's immune system, making them more susceptible to many diseases and infections. HIV becomes AIDS, autoimmune deficiency disease, when the person does not receive effective treatment. A person typically does not die from HIV or AIDS. They can die from a common cold just because their immune system is so low or weak that it cannot fight off the infection. How can AIDS be contracted? Well, AIDS can be contracted through homosexual relationships, heterosexual relationships, drug abuse, such as sharing needles, or even blood transfusion from infected blood. Here's the timeline. So HIV was initially brought to public attention in 1981 when it was defined as the human immunodeficiency virus. During that time in 1981, 337 cases were reported that year. And within that year, 130 deaths. By 2001, 20 years later, after being declared a threat to national security threat, or threat to national security, a 5-year plan was established to prevent the spread of HIV. By 2021, this year, there are more than 38 million people worldwide infected with HIV. Ryan White. There he is. Ryan White gained national attention when at the age of 13 he was diagnosed with AIDS after receiving a blood transfusion. Due to the lack of knowledge around HIV/AIDS at that time, Ryan received a lot of discrimination. It made it hard for him to go to school, for him just to be a normal kid and enjoy life. But neither he nor his mother would give up the fight for equality and for more to be learned about this disease. Posthumously, because Ryan died at the age of 19 years, a program was created called the Ryan White HIV/AIDS program to help people with HIV/AIDS get the treatment they need to continue living. So his story also helped to bring a sense of humanity to the situation, even though people may be infected with such a harsh-hitting disease. They are still human, they still have feelings, they still deserve to be treated with respect and kindness. How is the HIV pandemic being stopped? Interventions and strategies have been put in place. They are decreasing the viral load of those who are already infected with HIV so that they cannot transmit the disease, decreasing the viral load, keeping the viral load low, making it undetectable when tested, when the blood is tested, will keep a person who is infected with HIV from spreading the disease. Another option in preventing the spread is providing a pre-exposure prophylaxis, PrEP. Those are especially for people who are in homosexual relationship, male-male relations, that's one of the main sources that is out now to spread the disease. And then there's post-exposure prophylaxis, especially those for healthcare workers who interact with a lot of bodily fluids and blood. This is important for accidental exposures. All of these have been proven to be effective forms of prevention in clinical trials. That is, keeping the viral load down, having the pre-exposure prophylaxis, and then the post-exposure prophylaxis. And that is given immediately after what is believed to have been a possible exposure. Again, people can live with HIV. They can live normal lives. What's most important is that they take their medication as prescribed. The medication regimen is very important. They must be taken daily as prescribed to decrease viral load and keep it low so that it is undetectable. So get tested, know your status, protect yourself and others. There is help. There's a lot more information on HIV nowadays and AIDS. And even those who are living with AIDS are living with AIDS. So it's not necessarily a death sentence, though you don't want to take chances. Be safe. Here's my pre-test, post-test. How can a person get HIV? What year was HIV brought to national attention? What young man's story contributed to the HIV/AIDS awareness? How many people in the world have HIV currently? How is HIV treated? What does a person with HIV keep? How does a person with HIV keep their viral load low? How can you tell if a person has HIV? Who can be infected with HIV? How can HIV be prevented? And what happens if a person's HIV is left untreated? Here are my references. Thank you for listening.